Believe it or not, I actually get very excited when my patients tell me they're experiencing imposter syndrome. They feel out of depth after a promotion, or like they received a competitive college admission just by chance. Perhaps they feel like a fraud, like everyone's about to catch on to their inadequacies. I say, great, congratulations. That's right, I, a psychiatrist, celebrate when my patients tell me they have imposter syndrome. And in today's video, I'll tell you why that is and how to turn imposter syndrome into the greatest thing that's ever happened to you. So welcome back, everyone. And for those of you new to the channel, I'm Dr. Robert, a board-certified psychiatrist. And here I love to talk about various mental health topics. In today's video, I'll be discussing imposter syndrome. Okay, so first off, what is imposter syndrome? You've probably heard about it on social media. I feel like it's being talked about everywhere these days. So I want to make it clear, imposter syndrome is not an actual mental health diagnosis. Instead, it's a term people came up with to describe the sensation of not feeling adequate, of feeling like a fraud, especially in a new situation. It's anxiety that shows up when you're insecure about your abilities and your talents, especially when stepping into an unfamiliar situation or role. No matter whom it affects, it can be very, very distressing, very demoralizing. And as a result, it can even set you up for failure. So why is it that I want my patients to experience this? Well, of course, to be clear, right? I don't ever want my patients to experience any distress, discomfort, anxiety. My role is to reduce those things, prevent them. But the reason I phrase it as I want them to experience this is because I want to reframe that anxiety. I want to use that anxiety to work as empowerment. Because whenever treating anxiety, the best route is never trying to make that anxiety go away, pacify it. It's reframing it. It's reframing your relationship to it. After all, welcoming an unpleasant thought, an unpleasant sensation is the best way to reduce the power and anxiety it holds over you. So learning to use imposter syndrome as an indicator of growth rather than a barrier can be very, very empowering. And whenever a patient tells me that they are experiencing imposter syndrome, it means that something's changed in their lives. They've achieved something that they didn't think that they could achieve. And certainly that's worth celebrating. Because here's the stark truth about imposter syndrome. It is a completely normal experience. Most of us experience it at some point in life. Those of us who are more prone to low self-esteem, self-consciousness, anxiety might experience it more acutely, will make us more distressed. But ironically, it's also the thing that will make you less anxious the more you can embrace it, the more you can seek out situations that incite that imposter syndrome feeling. Because your anxious thoughts might be telling you, they picked the wrong person. It's just by chance that I'm here. I really don't deserve this opportunity. They're gonna find out that I'm inadequate, I'm not smart enough, dedicated enough, what have you. Even with parenting, imposter syndrome can come up of, how will I ever raise this child if I can't even get my own life together? And the danger is if you get stuck in that sort of mind frame, it can become a self-fulfilling prophecy. You'll be too anxious, too self-conscious to perform at your highest level. And then, you might lose that job. You might lose that opportunity. So how do I help my patients tackle imposter syndrome? Well, one, like I mentioned, I normalize it. Everybody experiences this to some degree. Likely many of the people that you may look up to, that you may see as these pinnacles of achievement, of confidence, they've probably struggled with imposter syndrome at some points in their career, in their lives, and might still be experiencing it to this day. They're just not showing it. Second, I tell my patients to lean into that discomfort. Don't try to push it away, rationalize it, get away from it, lean into it. That's because if they try to think about it too much, try to rationalize it, yes, they're qualified or not, you can't outthink a thought. I tell them, let's just acknowledge it, right? This is a new transition, a scary period, definitely some challenges, and it's okay to feel discomfort. That's all right. You're doing something hard and unfamiliar. So it's supposed to be scary. That's kind of how life works. And the sensation of anxiety that we call imposter syndrome, that's just a signal letting you know that, hey, you're traversing new territory, new things. It's telling you to be cautious, not to turn back. And sometimes maybe the imposter syndrome is true. I fill my patients in on that reality because I think that can be a thought they get stuck on and try to wrangle with. But I tell them, maybe it is true. Maybe you are not fully qualified for this. Maybe you didn't get it just by chance. That doesn't actually matter. What matters is you are doing the thing you're doing now. You're trying something new. You're in a new position. And that's actually what matters. Because I bet you many of the people you look up to now, they've had opportunities thrown at them, gain advantages that maybe they weren't fully qualified for. But once they were there, they were able to seize the challenge, to actually work and do the things that they needed to do to make everyone believe that they were actually competent enough. Because no one knows how to do everything perfectly right away. Everything is a process of learning. And that might be the case for you. And I really try to get them to move on from the thought of, am I qualified, am I not, am I up for this or am I not? Because that's a thought spiral that's just gonna get you stuck. It's not gonna let you progress forward. So what is that best way forward? Honestly, just fake it till you make it. Simple as that. Of course I get it, right? That's much easier said than done. That's honestly the best way forward. You keep showing up, you keep doing and being the best fraud you can possibly be. That's what I tell my patients. You're gonna be the best fraud, the best imposter you can possibly be. And you're gonna fool everyone around you. Hopefully most of the time, maybe not all the time, but you're just gonna do your best to be that good fraud. Keep fooling everyone. And eventually the joke will be on them, right? Because you'll actually be performing, you'll be doing the things you gotta do. Because everybody around you that you think is successful, that's what they do. They just show up and they act a fraud. They do the best that they can to fool everyone around them, and it works. Now, my friends, it's your turn. On the topic of celebrating imposter syndrome, I think there's also something to be said when I think people don't experience this often enough in their life. So I think it's worthwhile asking yourself, have you stopped challenging yourself? Have you stopped seeking out new opportunities? Does the fear of failure hold you back? Have you chosen safety, familiarity, comfort over potentially new opportunities, new risks? And it's not necessarily a bad thing. I'm not saying that's in and of itself a bad thing, but it's worthwhile at least reflecting on, is perhaps my anxiety over potentially experiencing imposter syndrome keeping me from new opportunities that might actually help me grow and do the things I actually want to do? Just food for thought. I think that's a reasonable consideration to have once in a while. Or are you constantly preparing for something, always in the planning stages of things, because it's very frightening to take the leap and try something new. After all, nobody enters a role fully prepared for it. They have to grow into it. And just as I'm talking about this, I'm kind of reflecting on my own life, right? All the experiences of imposter syndrome I experienced. I'm a first-generation immigrant, and I'm certainly going to college was that first kind of big leap, and then medical school was a huge one, being on the rotations during third and fourth year and all these new clinical settings, doing all these, scrubbing into surgeries, doing all of those things kind of elicited some of that feeling, having to give presentations in front of experienced doctors on patients that you barely knew anything about. Then of course, residency training, becoming chief resident, going into private practice, now starting my own private practice, starting a YouTube channel, with you guys. All these huge leaps of faith and sort of needing to step out of my comfort zone, taking on these experiences of imposter syndrome, but still doing it, right? And sort of taking that feeling and reframing it not as something scary, but as something empowering, something that's an indicator of growth, of challenge towards oneself. And I try to relay that to my patients to also help them grow, to take the risks that they want to take, but might be a little bit risk averse towards taking. So my friends, here's my message to you. If you're experiencing imposter syndrome, try not to view it as something that's scary, frightening, though I know it can be that, but try to reframe it as something that's also empowering, an indicator that you're doing something well. If you're experiencing it, definitely acknowledge it and tell yourself that it's okay. You're growing and you're not letting anxiety hold you back. If it's been a long time since you felt imposter syndrome, maybe look around and see what are some of the scary but fruitful opportunities around you. And try to be an imposter, the best fraud you can be. All right, my friends, so get out there, fool the world. I really appreciate you watching to the end. And if you like this video, definitely check out my future videos, like and subscribe. I really appreciate it. And I hope to see everyone next week.